Good afternoon, and thank you all for coming out this afternoon to this press conference. Joined again today, as usual, by Dr. Joe Cantor. He'll be speaking to you in a few minutes. We've got quite a bit to go over, and today the National Governors Association is having its winter meeting. It's a virtual meeting, and that's what I've been doing, and I've got to get back to it relatively soon, but we're going to get through this presentation. Dr. Cantor will make his presentation, and of course I'll take a few questions at the end. I'll start with an update on the winter weather response and recovery, then move to the COVID update, and finally give a preview of the executive budget presentation that will happen tomorrow at the Joint Legislative Committee on the Budget. Last weekend, as you know, I traveled to Shreveport on Saturday, met with local leaders from there in Bossier and elsewhere across North Louisiana on the needs that they still have following the extreme winter weather. The good news is that power has been restored to all but about 100 accounts, and those aren't in the Shreveport-Bossier area. Those are primarily over in the Catahoula area. But there remains a lot of work to be done around water systems. I can tell you that the National Guard has 1,949 guardsmen in support of emergency operations. About half of those are working COVID missions. The other half are working winter weather missions. They have distributed, as of now, more than 2.2 million liters of water. We currently have 12 weather-related water outages. These are water systems that are out that are affecting about 24,000 people, and then 8 of those are community water systems. We also have weather-related boil advisories. 218 of those remain in place, and we have about 600,000 residents across the state of Louisiana who are impacted by the boil water advisories. Already 170 water systems have had their storm-related boil water advisories lifted. We do sadly have an additional death to report that's attributable to the winter weather. It was a 61-year-old male in Caddo Parish who died from exposure. I think the coroner in Caddo Parish confirmed that death yesterday and that it was related to the storm. The Department of Children and Family Services received federal approval for automatic SNAP benefit replacements for 3 parishes. Those are Avoyelles, Red River, and Sabine, where more than 50% of the SNAP households lost power for more than 24 hours because of those winter storms. This waiver is going to allow households to receive replacement of 45% of February SNAP benefits as a result of the power outages. Benefits will be available this Saturday, February the 27th, for those individuals. All other SNAP clients who lost power for more than 24 hours and lost food purchased with SNAP benefits as a result can request replacement benefits individually. They'll have to verify their loss from the power companies, and then DCFS will send more mass text messages out and communicate with all of those individuals as to how they might access these benefits. The deadline to request SNAP replacement benefits has been extended to March the 10th. I think I'll shift to COVID now. Today we're reporting 779 cases on 55,753 tests. Very sadly, we're also reporting 33 new deaths, which brings the total number of deaths to 9,561. I knew it had been a very, very long time since I reported 0 deaths, so I went back this morning to take a look at that. I think it was March the 22nd of 2020 was the last time that we had a 24-hour report that had 0. And so I'm really looking forward to getting back to that. Hopefully that day will come soon, especially if we can keep things moving in the right direction. They are moving in the right direction at presently. The most recent positivity number for the state is 5% for the week. That's about a third of what it was 6 weeks ago. Consequently, we have about a third of the number of people in our hospitals as we had 6 weeks ago, too. Cases are down, deaths are declining, but still, today, 33. I mean, that's a lot. We still have some work to do there. There are 679 people in the hospital across the state from COVID. That is down 8 over the last 24 hours. We have 100 of those individuals who are on mechanical ventilators, and that's down 2. So our trends are looking positive. We were seeing a tremendous decrease in testing as a result of the Mardi Gras and the winter storms, but just over the last 3 days, we have reported more than 100,000 tests. And so our visibility into what's actually happening in Louisiana appears to be improving over the last few days. We hope that continues. But we won't get to the numbers we had in January when more than 900,000 individuals tested. We have administered more than 925,000 doses of vaccine, and that includes 593,576 series being initiated and 332,415 of those complete. We now have 2,062 enrolled providers across the state of Louisiana partnering with us. That means they've been approved by the state and by the CDC to both receive vaccine directly and to administer those vaccines. Yesterday, the FDA put out encouraging information about Johnson & Johnson's COVID-19 vaccine. The full FDA panel meets tomorrow. If the FDA grants emergency use authorization, obviously that would give us a total of 3 vaccines that we will have at our disposal to employ. And we could have the Johnson & Johnson as soon as next week, but that's assuming, of course, that the EUA is granted over the weekend. And we certainly don't know that that's going to happen, but we do believe it'll happen soon, and that's a very positive development. And I assume you're going to have a lot of questions about vaccine, both because of the Johnson & Johnson, but also to the disruption that we've had with respect to the receipt of vaccine last week and this week, and then what we're looking forward to. So at this time, I'm going to ask Dr. Cantor to come up. Please direct any questions that you have for him to him before he leaves the podium, and then I'll come back on the other side of Dr. Cantor and give you some additional information, then we'll wrap up. Thank you.
Thank you, Governor. Thank you for your leadership. Good afternoon, everyone. It's a pleasure to be able to share some good news on a couple different fronts with you today. So before I get to that, I do want to ask everyone who's listening that due to the disruptions in the supply of blood, donated blood with the storm, we have a critical need for blood across the state. So I'd like to ask everyone out there if they would be so kind as to consider donating blood. And if you happen to have type O blood, I'll ask you twice to do it. But we could use a lot of blood across the state. Our hospitals are asking that we put this message out there. So consider it. You can do it if you've done it in the past. It's easy to do. It's pretty safe. And you can look online for a blood center near you. You can call 211. It should be pretty easy to find a place to donate. Thanks for considering that. So let's get on to some good news. As the governor had mentioned, there's a high likelihood that we could have some more vaccine, particularly the Johnson & Johnson variety, very, very soon. So the timeline is as such. Yesterday morning, the FDA released their own review of the Johnson & Johnson trial data, along with some other documents prepared by the company in advance of the VRBPAC committee. That's the Vaccines and Related Biological Product Advisory Committee. It's a committee of the FDA meeting tomorrow, as the governor mentioned, to consider recommending emergency use authorization of the Johnson & Johnson vaccine. If they make that recommendation, then the leadership of the FDA will consider that. Based on what we know about this vaccine, based on the information that was released publicly yesterday, we anticipate that it's going to be authorized, but we don't want to get ahead of the horse on that. If that authorization is made, then the CDC Advisory Committee on Immunization Practices will then meet and consider more granular recommendations about how the vaccine might be best used and any other considerations to be aware of. If all of that happens, if all of those dominoes line up appropriately, we could be receiving Johnson & Johnson vaccine, as the governor said, as early as next week, which is very, very exciting for us for a number of reasons, and I want to go through these. Number one, this vaccine is significantly easier to use. Firstly, because it's a one-dose series, one and done, one shot and you're done. Don't have to come back, don't have to coordinate, one shot and you're done, which is something that we don't have with the vaccines now. The other reason why this will be great for us is the vaccine is a hardier vaccine. It's easier to transport, it's easier to store, it doesn't require ultra cold, it lives longer in a regular fridge and freezer. So it's going to be a lot easier to move this vaccine out into the field, to do events with it, do small community strike teams. And we've done a number of the smaller events already, but have been logistically quite complicated. This will ease that process considerably. And the last reason is this is additional doses coming to the state, if all those things line up, above and beyond what we're already getting with Pfizer and Moderna. And we have been told to, this is an unconfirmed number, but we have been told to anticipate that if FDA authorizes and if the CDC ACIP committee puts out their recs, we've been told to anticipate about 37 to 38,000 doses the first week, which is a considerable number for us. So all of that is really, really encouraging to us. What we know about the Johnson & Johnson vaccine so far is that just like Pfizer and Moderna, it's a very safe and highly efficacious vaccine. It has the benefit of being tried, not just in the US, but there were big arms of the trials, and these were about 40,000 people in the stage 3 Johnson & Johnson trial, split pretty evenly between the US, Latin America, including Brazil, which is important because there's a variant of concern out there, and South Africa. So a very, very broad breadth of subjects, a little bit different from the other trials, from the other vaccines that we've had. Protection after this vaccine ramps up gradually. At 14 days afterwards, you have very, very good protection. And at 28 days, you have a little bit even better protection. At 28 days and going forward, 0 deaths and 0 hospitalizations in the vaccinated arm of that trial. So to put that in other words, this vaccine does exactly what we want when we get vaccinated, which is protect yourself against serious complications and death. That's why we're getting vaccinated. And this vaccine, as shown in the trials, and again, the FDA is going to review this in a public fashion tomorrow, and then the CDC as well, highly, highly efficacious. So very, very exciting news for us. What it means for people of Louisiana is it's going to be easier to access vaccine. There'll be more vaccine out there. We'll be able to do events. We'll be able to supply providers that we haven't been able to supply yet because of supply constraints. And logistically, again, with a one-and-done shot, it's that much easier. So I'm really, really excited about this vaccine. This is a good day for us. If the FDA authorizes and if the CDC makes the recommendations that we think they're going to make, we'll all be paying very close attention. And those meetings are all public. They all get streamed online. So this is a very transparent process. I will say the data that continues to come in on the existing 2 vaccines, the Pfizer and the Moderna, excuse me, continues to be very encouraging data. The best data we're getting right now actually comes from Israel. And the reason is threefold, really. Relatively small population country. They got a ton of doses from Pfizer. They have a lot of doses from Pfizer. They've been able to vaccinate about 50% of the country right now. And not only do they have a unified health system, they've had electronic health records going back 20 years. So they have a lot of good data to mine. And they just published a good study in the New England Journal of Medicine, essentially confirming what the Pfizer trial data confirmed, which is that upwards of 94, 95% of the population that gets vaccinated are protected from COVID. And they're seeing a commensurate decrease in the amount of circulating virus that's out there in the country, which again, we are slowly building an evidence base to hopefully prove that these vaccines not only protect someone from getting sick, but also reduce transmission. We haven't proven it yet, but the evidence base is mounting, and this Israel data is really, really encouraging on that. A number of pregnant women have been in those experiences, in those data sets in Israel. Pfizer is now doing a specific study on pregnancy. Those studies are ongoing. There has been absolutely zero suggestion to date that these vaccines are in any way dangerous in pregnancy. And I mention that particularly because we are now offering vaccine to pregnant individuals in Louisiana. And I want folks to know that we have complete clarity right now on what the risks of COVID are in pregnancy. And that's increased maternal complications. And as the governor mentioned last week, we already are one of the leading states in the country of maternal complications and an increased risk of preterm labor. We know what those other risks are. The recommendations of both the WHO, the CDC, and the American College of Obstetrics and Gynecology are very clear. They advocate strongly that pregnant women have access to this vaccine, because there has been no suggestion that it's at all dangerous to either mom or baby. So that's really encouraging. I'll tell you on a very personal level right now, my wife and I are expecting, and my wife is actually getting vaccinated today. She was able to make an appointment a couple of days ago. It was supposed to be for a couple of weeks from now, and the pharmacy called her yesterday with someone with a cancellation, and she bumped it up. So I'm a big believer in this, and I think anyone who is expecting should go have a conversation with their obstetrician or midwife. This is a good level of protection that I don't want people to pass up. I want to move on a little bit, and more and more we're hearing about teachers and other educators and daycare staff getting vaccinated now that the eligibility is there, and that's really encouraging. I want to make one correction from a number we gave the other week, and Sam, I think you brought this up, so thank you for raising it. The total denominator for K through 12 plus daycare teachers and staff is actually 160,000. I think we had said 95,000. It's actually 160,000. That includes some early start staff and some private schools as well. And it's interesting, going forward when we add new eligibility categories in the future, it's actually going to be less pertinent what those numbers are, because more and more individuals in future eligible categories are getting vaccinated because they fit a previous category. And that's going to happen more and more. So I just wanted to flag that as we go forward. But Sam, thank you for bringing that up the other week. Let me talk a little bit about what we expect in terms of deliveries coming up. We are, as of today, caught up in what we had lost ground on due to the storm last week. So every delivery that was due into the state that was delayed last week because of the weather, and then delayed a little bit in the beginning of this week because the feds were catching up their deliveries, is now in state right now. So, and we believe going forward next week, the delivery is going to happen on time. So all of those doses are now in state. So we've caught up from there. I think people are still having appointments rescheduled, and providers are working through those lists. So I do think there's still going to be a little bit of a lag in the number of people that get noted as vaccinated, on the dashboard. And I expect next week that those numbers pick back up. Looking forward, what we expect to come into the state in the coming week, which will be week 12 of vaccinations, we expect for Pfizer 52,650 doses. That's an increase of about 7,000 from the week prior. We expect 45,000 doses of Moderna. And again, estimated, if all of those dominoes line up appropriately for Johnson & Johnson, somewhere between 37 and 38,000 doses of Johnson & Johnson. So if all of those line up, that'll be the biggest allocation that we've had to date. And it couldn't come at a better time, because the weather is cleared up, and we have newly eligible categories as of a week and a half ago, and our providers are ready to administer those vaccines. So that's very exciting. The other good news to share is that cases continue to go down, both in Louisiana and across the country. It's clear that we had a very big spike, the biggest spike we've had to date over Christmas and New Year's. And now, as the governor noted, particularly with the hospital numbers, we're going down impressively. Percent positivity this week is flat, at 5%. We did lose a lot of testing last week with the weather, and we're picking that back up now. So I want to give a caveat with some of the numbers on that you can't identify cases when the testing takes a lag like that. But by other indicators like hospitalizations and so forth, we're no question going in the right direction. And particularly to nursing homes, and we've talked before about what we should expect with nursing homes now that we have a good base of protection with vaccine there. As of today, and again, I say this with the caveat that there was a little bit of interruption in nursing home testing with the storm. But as of today, we have the lowest number of new cases in nursing home residents than we've had since the first spike. So that is encouraging. That number is 43 new cases over a 7-day period. So all of those are really encouraging. And again, by design, the intent was to vaccinate the most at-risk people first, because that's where the hospitalizations are and that's where the mortality is. And it's encouraging to see that play out. That said, despite our numbers going in the right direction, we remain concerned about the variants. And this continues to be a tip of the iceberg scenario where, with the relatively little amount of genomic sequencing that's done in this country, when you have some identified cases, you have more that you just haven't formally identified. So to date, we have confirmed 18 cases of the B117 or the UK variant. Those are in regions 1, 4, and 7. There are an additional 50 cases of suspect pending confirmation with the CDC. Those are in regions 1, 4, 5, 6, and 7. We anticipate all, or at least most of those, are going to end up being positive. The CDC is taking more time to confirm these because of the volume of suspect cases being sent into them. I can tell you nationwide, there's just shy of 2,000 identified cases of this variant in 45 states, although I would bet anything that it's really in all 50 states. It just hasn't been identified. That's all the reason to continue being vigilant with our mitigating measures. All the reason to continue masking, continue distancing. We know this variant is growing. We know it's circulating. We know it's transmitting. We need to do all we can now to continue to suppress transmission so that we don't give it a foothold. And the way this plays out, if we do a good job of that and suppress transmission enough and buy us enough time to get enough vaccine out there, we can avert what we fear might be another spike. If we drag our feet in either one of those, we might not be so lucky. So that's really what the strategy is now, is to continue to drive transmission down so that we can put ourselves in the best position to avert a spike by virtue of having transmission low and getting enough vaccine out there by the time this variant increases in numbers beyond what it is now. We've not identified any cases of the B1351 variant, that's the South African variant, yet in Louisiana. It has been identified in 14 states, closest to us being Texas, Tennessee, South Carolina, and North Carolina. We've not yet either identified any cases of the P1 variant, that's the Brazilian variant. Those have been identified in 4 states, Minnesota, Oklahoma, Maryland, and Florida. We'll let you know if any of that changes. So again, very encouraged about the Johnson & Johnson vaccine, very encouraged by the continued progress that everyone in the state is making at reducing transmission and recovering from a very damaging spike over Christmas and New Year's. And I'd like to ask people to keep it up. It's been good work. So with that, I'd be happy to take any questions. Sam?
It seems like a lot of people are, even though it's effective, the Johnson & Johnson vaccine, a lot of people may be wanting to hold off until they can get the more efficacious Moderna or Pfizer vaccine. What's your message to people who may think, I'm going to wait around until I can get the better vaccine?
Don't do it. That would be a strategic error. Supply of vaccine is still limited. The first chance somebody has to get vaccinated, take that chance. Do not pass up that opportunity. These trials are not apples to apples, and they're not head-to-head trials either. So it's very challenging to compare these trials between each other. What is apparent with this vaccine, again, the FDA is going to confirm this when they meet, I think, tomorrow. But what looks to be apparent is 100% efficacious, the Johnson & Johnson vaccine, at preventing death and preventing serious illness that results in hospitalization. That's what you really care about. I mean, when you get vaccinated, when your family gets vaccinated, when you encourage a loved one to get vaccinated, that's what you care about. you care about not having to worry about the most feared complications. And that's why this pandemic, that's why this virus has caused such a disruption in our life. It's that we fear for the worst complications. If all it was a mild cold and nothing more, it wouldn't justify the response that we've given. So very good vaccine. Again, one shot is great, and don't pass up the opportunity. If someone has the opportunity to get vaccinated, don't fall in the trap of trying to parse one versus the other. This is a golden opportunity. You might literally pay for that decision with your life. So don't pass up the opportunity. Yep, Melinda?
In terms of the declining numbers, including the steep decline in hospitalizations, what are you attributing that to? Does the vaccine have anything to do with that in your mind, or is it a change in behavior? I mean, what do you attribute it to?
You know, I think at this point it does with the vaccine. I think it's certainly multifactorial. And, you know, we're coming down from a spike. We've come down from 2 spikes previously. And cases go up, cases spike, and cases come down. And that's, you know, reflective across the country as well. And that's a result, I think, of behavior change and people taking it seriously because they're seeing so many friends and family and other loved ones, you know, being affected by it. I think at this point, today we have about 13% of the state has initiated, at least initiated the vaccine series. And it's not a random 13%. You know, by design, it is a 13% of very high-risk individuals. Nursing home residents, healthcare providers, people of advanced age, people with significant comorbidities, people who are likely to be hospitalized. And at this point, with that level, I think we are beginning to see a reduction in hospitalizations because of who has been vaccinated, who has been protected. Yes?
How are the efforts going to get a better idea of the demographics for who's getting vaccinated? I know that states that are reporting those demographics are seeing black patients are not getting vaccinated at nearly the rate that white patients are.
They're going, okay. I'll tell you, the quality of our data, what we're able to get visibility on, has improved dramatically. And I do need to give a shout out, so to say, to the team at the Office of Public Health, Teresa Sokol, who's our acting state epidemiologist, Lee Mendoza, who runs the Bureau of Health Informatics, and both of their teams have done remarkable. And we're actually one of the leading states in the nation right now in how to get better quality data. You know, nationally, about 49% of every vaccine administered does not have racial data attached to it. That's the data that the CDC put out a couple of weeks ago, and I actually had the pleasure of joining a big CDC conference on Tuesday where we talked about this very issue. Here we have been able to get that unknown number down to 10.8%. And the way we've been able to do that is by reconciling data with existing databases that we use in the state. And we did the same thing with our testing data a number of months back. So we're able to get visibility, and we're actually one of the leading states on that right now. The flip side of that is we have disparities. There's absolutely no question about that. And if you look at the data now, it becomes very clear. And I think those disparities are multifactorial and either related to inequities, health inequities that we know go back decades, if not generations. Everyone on the Louisiana Department of Health and the governor's team is committed to addressing that above really anything else right now. We want every single community in the state to have access to the vaccine and access to the right information so that they feel empowered to avail themselves of it. This is going to be work we have cut out for us going forward, you know. And I think we need everyone's help in this. This is not something that the health department does alone. This is something that we do in partnership with community-based organizations, churches, leaders. We need everyone in the state on this, and that's what I hope happens going forward.
Are there any planned initiatives to try to get that disparity fixed?
There are, and a lot of these I want to give we're working closely with the COVID Health Equity Task Force, and there'll be significant community organizing events and the media strategy to follow that. I don't want to get too ahead of that right now, but there is a big cornerstone of this work, though, is working in partnership with folks on the ground. Because I know, me as the state health officer or even the health department, this is not something that we can do on ourselves. So we're working really hard to make partnerships now, and that will be what we base this on going forward. Yep.
Doctor, what are the visitation restrictions? And at nursing homes, since we already have a large portion of our seniors having an opportunity to get vaccinated?
Yeah, a couple of things on that. They're actually much more relaxed now than people might realize. And if a family doesn't feel like they have visitation access, I think there's probably some communication barrier going on because the actual rules right now are very, very flexible for indoor visitation and outdoor visitation. There's a lot of ways to visit, particularly now with the case counts and the % positivity going down. But the other point is they are federal rules at this point. So the visitation rules right now are CMS or federal rules. So everyone in the state is bound by those rules. I do expect those to be relaxed, particularly as more data comes out about the risk of transmission once one is vaccinated. They haven't relaxed it yet, but I would expect them to do so. Well, I'll wrap there. Again, I want to thank everyone for the hard work. Just remind folks that it's not over, and we have our work cut out for us to continue reducing transmission, particularly with these variants that are out there. So thank you.
Thank you, Dr. Cantor, and congratulations on the upcoming birth. I didn't realize that was going on, but I'm happy for you and your wife. With respect to the vaccine and its safety, I think now that we have administered hundreds of thousands of doses here in Louisiana and millions across the country, we can absolutely dispel some of the concern that was out there at the outset that people would have immediate and severe allergic reactions in considerable numbers. We're just not seeing that at all. And so they are safe and effective, and I'm convinced that if the FDA issues the emergency use authorization for the Johnson & Johnson vaccine, that it too will be safe and effective. And we encourage people to take advantage of the earliest opportunity, once you're able to do so, to be vaccinated. That really is the way we put this pandemic behind us. There is no other way. And so we're encouraging people to do that. I do want to lend my voice to something that Dr. Cantor mentioned, and that is the need for blood donations. I speak with doctors quite frequently all around the state about COVID, about capacity and different things, testing and vaccinations. A number of them have mentioned to me this week that the situation on blood is serious. And so we are encouraging people to donate. Lots of ways to be connected with these blood centers, but please call 211 if you have any questions. A lot of people donate on a regular basis, and maybe they can just go ahead and speed that up and donate again now. And it is safe. There's nothing dangerous about giving blood right now. So would encourage people to do that. I'm going to turn now to the budget. So tomorrow, the Commissioner of Administration, Jay Darden, will be presenting the executive budget proposal to Jlcb. It's been a challenging year for us and for our country in a lot of ways. And certainly at the outset, we didn't know exactly how this was going to impact health, the economy, so many other things that are going on. And therefore, it might come as a surprise to people because of these challenges that we've been able to put together a budget proposal that is balanced and that requires no cuts. Now, that doesn't mean that we aren't still challenged by COVID, and there will be a number of COVID-related expenditures going forward. Every business, every family, every government has more expenses associated with operating during a pandemic. And we also know, and I think I'll speak some more about this in a moment, that we really need further assistance from the federal government. And I do hope that the stimulus bill that is under consideration will pass in some form or fashion that certainly has state and local funding attached to it to help meet those expenditures that I just mentioned. But also, we know that our unemployment insurance trust fund is back down. I think today's number in the UCG this morning had about $6 million in it. So clearly that's going to be completely exhausted again very soon. We'll be borrowing money, and even though you're able to borrow money interest-free, it does have to be paid back at some point. We've already borrowed about $133 million The payback starts in September. And so it would be really helpful if we could replenish the trust fund, pay back what has been borrowed. Because if we are unable to do that, then there will be, at some point in the not too distant future, a tax hike on all employers who pay into the unemployment compensation trust fund. That's obviously not something you want to do as you're coming out of a pandemic and the economic troubles that were related to it. So we're in a better place than many thought possible. I can illustrate it another way. We were right at 300,000 jobs lost after the onset of the pandemic, and that was at the worst. All but about 80,000 of those jobs have returned. Now, we still have an awful lot of people out there who are not employed, who want to be and need to be, and some people are underemployed. We've got a lot of families. But that's just a measure of how things are, in fact, improving. And things have been improving in Louisiana for a number of years now. If you go back to the structural budget deficit that was created in, over a number of years, but really got to an unsustainable place in 2015, 2016. And in fact, Moody's recently upgraded our credit rating from stable to positive, the outlook, I should say, from stable to positive. And this is the first step towards getting a bond upgrade, which is obviously what we want. And they discussed extensively the responsible budgeting that has been happening in Louisiana recently, the stable revenue, the fact that we're paying our bills, we're paying back into the rainy day fund, the budget stabilization fund, and so forth. The REC has improved our revenue forecast for next fiscal year, obviously the year that starts on July 1st of 2021. We have benefited from the CARES Act that was passed earlier in 2020. And in particular, I will tell you, and this is something that we're very appreciative of, and it started under the Trump administration and has continued under the Biden administration, is an enhanced FMAP, about 6.2% of the portion of the Medicaid program paid for by the federal government. That has been extended to all states, at least through the end of the calendar year. And that has had a big impact on our ability to fashion the budget we're going to present on tomorrow. So we were able to balance the budget. We are not proposing cuts. And in fact, we're going to propose some critical investments, especially in education. So this is some hopeful and bright news in a period of time that really, quite frankly, hasn't been so bright. The budget we're proposing includes modest but meaningful pay raises for K through 12 teachers and support staff, as well as higher education faculty, an increase in the higher education formula, and more dollars to GO grants, the need-based aid for higher education. And obviously there will be an increase in TOPS too, just given the number of students who will be participating in TOPS next year. Specifically, under our proposal, educators will see a $400 increase next year, and support staff would receive an additional $200. And we obviously know that our teachers, support workers deserve more than that. I am absolutely committed to delivering more teacher pay over the remainder of this term, but we always knew that it'd be a multi-step, multi-year process. But this is another step in the right direction, and that would be funded by a 1.375% increase to the MFP, that portion of the funding formula that typically goes to pay. I would point out that this budget does not take into consideration anything that's presently pending before Congress. And so every day you're seeing news about whether there's going to be state and local aid in the next package, and if so, how much, and all the other various forms of funding, whether it's for K through 12 or higher education or healthcare delivery system, another round of PPP, another round of unemployment. Obviously, until something's passed, we don't take it into consideration in terms of our budget. We do know that as part of the package, Congress is considering an increase to the federal minimum wage. And I know this is also one of the things that makes that particular package somewhat controversial for some. You all know that I have supported an increase in the minimum wage here since before I was governor. We have asked for one every single year. The minimum wage at the federal level remains $7.25 an hour. It's been at that level since 2009, and that's what it is in Louisiana, because we're one of just a handful of states that don't have our own minimum wage. So I have written a letter to our congressional delegation encouraging them to find a way to increase the minimum wage. And hopefully it'll happen in the reconciliation. If not, some standalone bill, because $7.25 in 2021 simply is insufficient. And on top of this, studies have shown that we have the second highest percentage of workers in the country who actually work for the minimum wage. So for all of those reasons, and the fact that the pandemic has actually exacerbated the problems caused by such a low wage, that I believe it's time that we increase the minimum wage. There will be additional efforts in Louisiana this year in the session that starts in April. Quite frankly, I support them. There are going to be multiple bills, and hopefully we can find a way to do this. And the vast majority of people in Louisiana support it. I'd ask you to look at what happened on the first day of January of this year. I think it was about 20 states started with an increase in the minimum wage because of work they had done previously. Just last year, at the same time President Trump won the electoral votes in the state of Florida, I think it was 60% of those voters voted in favor of a $15 minimum wage, of course staged out over 4 or 5 steps. So it's something that we need to do. I'm encouraging the congressional delegation to pursue this at the federal level, and I'll continue to support it at the state level as well. Obviously, with respect to the budget proposal, the Commissioner, Jay Darden, will be there tomorrow. There'll be a lot more details there at his presentation, so I'd encourage you all to tune in. But the bottom line is we are in a much, much better place than we thought might be the case. And I want to thank our federal partners, the Trump administration, now the Biden administration, for making that possible. The work that our congressional delegation has done, for the assistance that we have received and we're going to continue to receive for some time going forward. Before I take your questions, I'll let you know that our next press conference will be next week on Tuesday. I'm thinking we're going to do that around 1 o'clock in the afternoon here. We'll let you know for sure. I do get my second dose next Tuesday afternoon as well. And in fact, as I was preparing to come in here, I received a text message from FMOL reminding me of that second dose appointment. And that's part of the logistical challenges around a 2-dose vaccination series that we don't have with Johnson & Johnson, is getting people back on that 21st day if it's Pfizer, and it doesn't have to be exactly the 21st day, or the 28th day of Moderna. But I do look forward to being vaccinated with a second dose next Tuesday afternoon, and I think you're all going to be invited to come out to that as well. So with that, I will take some questions. Yes, ma'am.
In terms of the money that's used to balance the budget and avoid the cuts, is that all, is the federal assistance mainly coming from the FMAP increase, or are y'all using some of that second round of congressional aid that was passed in December to help offset something?
Well, the biggest part of it, and again, this will be detailed tomorrow by the Commissioner, the biggest part is the FMAP. As you all know, the Medicaid program, and this isn't unique to Louisiana, but to every state, is the single biggest expenditure item. And so anytime you get relief on the Medicaid program and lower the expenses that the state incurs in that program, it provides a tremendous amount of flexibility. And so that is the biggest effort. Now, I will tell you that the CARES Act funding for state and local government, that was all appropriated, that was all allocated out in December of last year. So I'm not going to tell you that there aren't some dollars still being brought to bear, but for the most part, that is behind us.
But there was that additional round of funding that
Yeah.
passed in December that had like $1 billion for education, for example.
Yeah,
I didn't know some of that.
and so we have a little over $1 billion for K through 12 education. We have, and my numbers are going to be a little bit off, but more than $100 million for early childhood, about $250 million for higher ed. No, we're not taking that into consideration because those dollars have specific strings attached to them and things that they can be used for and can't be used for. And quite frankly, some of the rules by the federal agencies that actually dictate how those dollars can be spent are just now starting to come down. And so you had an appropriation in the last Congress that was overseen by the last administration, but now you have a new administration and new people who are writing the rules. So for example, just the other day, I believe we got the rules associated with the Emergency Rental Assistance Program funding that was funded in the appropriation in December. But the rules just came down the other day about how the program has to be structured with those dollars. And that's continuing to happen around all of the funding that came down in December. We're very thankful for that funding, and there's considerable funding there for K through 12, and I know Superintendent Brumley, for example, has been talking about their approach to that, and much of that money flows directly down to the districts, by the way. Yes, sir.
You said you've contacted the congressional delegation. It appears that the Louisiana's House congressional delegation will unanimously vote against this package. How can you be so far out of step with? Why do you think that both of you are so opposing ideas on this?
Well, the letter, as I mentioned, asked them to support an increase in the minimum wage. That could be possible with this particular instrument. It'll depend on how the Senate parliamentarian rules and what amendments get offered and so forth. As to whether they vote for or against it and why they make that decision, you'll have to address that question to them. I am 100% confident that the vast majority of people in Louisiana support an increase in the minimum wage. It's been demonstrated time and time again with polling information. It's been demonstrated time and time again in other states when they're given opportunity to vote on it. The most conservative states in the country overwhelmingly support an increase in the minimum wage, and we're one of just a handful of states that haven't created our own minimum wage, and we're still on the federal minimum of $7.25 an hour 12 years later. We can do better than that, and I'm encouraging our congressional delegation to do that, and I'm encouraging our legislature here in Louisiana to take this up this year as well. Yes, sir.
Hospitalizations and case numbers continue to go down. Do you still see any sign of loosening restrictions next week for businesses?
Well, as you know, I don't make announcements about what the next proclamation looks like until after I have the benefit of a gating criteria meeting and recommendations from the Department of Health and the Office of Public Health, and I haven't done that yet. Obviously, when you look at the trend lines, they are good, and so I would anticipate that we will have a new proclamation, meaning not just an extension of the current public health emergency proclamation with its restrictions and mitigation measures, but that there will be new features in that, but I will make that announcement to you all on Tuesday at 1 o'clock as to what that looks like. I'm just not going to get there now. But one of the things that I'm most gratified about is typically you just look at the trends, and quite often as soon as things start looking better, people start saying, okay, you got to lift restrictions now and do this, that, and the other. Well, if you have a really high baseline, the fact that you may have a week or two of improving trends doesn't mean that you're in a materially better place. But when you have lower baselines and good trends, that's when you can feel confident about moving forward, and it appears to me that that's what we're going to see. But Dr. Cantor gets the opportunity on Monday of next week, as we always do, to present a very detailed set of data points to inform the decision going forward, and he will follow that up with a recommendation. And I'm just not going to get in front of him by announcing something today, because that's just not the way we do things. Yes, sir.
Governor, there's plans for a mass vaccination site at the convention center in New Orleans. You've talked about how the Johnson & Johnson's going to enable more of that because of all the reasons you've laid out. Can you talk about specifically where else in the state? Are you talking with LSU about a Tiger Stadium site or anywhere else in Baton Rouge or any other specific sites that are going to be up and running here in the next few weeks?
Yeah, and so we need to be careful when we talk about mass vaccination sites and what's going to happen, what's not going to happen. I believe that if and when, and it's going to happen, I think, and the sooner rather than later, that Johnson & Johnson is approved, that it is a good candidate for mass vaccination events for a couple of reasons. One is those are net new doses on top of what we're currently getting in Pfizer and Moderna. And secondly, they're one shot, so you don't have to try to get those people back. And because there's an easier way to store the Johnson & Johnson vaccine as well. But as I stand before you right now, the FDA has not granted an emergency use authorization. And so to talk about specifically how we would employ them or whether they would go to that specific site you mentioned, I think you talked about the convention center, it is premature. Now, we do anticipate that FEMA is going to, is working with us to create a site in the New Orleans area upon request from the city of New Orleans that flowed through GOSEP to have a mass vaccination site in Louisiana. We don't know yet when that's going to happen. We don't know the number of doses or the types of the type of doses that will be used. And so I just don't want to get too far in front. But as soon as we're able to do that, we're going to let you all know. But I can tell you, and I think we've told you before, we're looking at these types of events happening all over the state and working very closely with our regional medical directors and as to what the right mix is for those particular regions. Because of geography and the ability for people to get transportation to and from the site, does it make sense to really have one mass vaccination site added for a region, or would multiple smaller sites that wouldn't necessarily be considered a mass vaccination site be better for those particular regions? So we're doing all of that work now, and it would be my hope and quite frankly my expectation that in the not too distant future we're going to be announcing some of this. But what you saw come out of the convention center is a partnership between New Orleans, the convention center, and Children's Hospital to run a mass vaccination site at the convention center, and they gave us the number of doses that they would be able to administer in a certain amount of time, and now we're trying to make that work. But it's just too early to say when that's going to happen or which type of vaccine will be used. Any other questions? I hope not, because I have to get back to the concluding session of the National Governors Association winter meeting so that I can have some of these conversations directly with the president about vaccine and hear from his team. Did you have one more question? Well, we just, what today is Thursday, so it was just Monday that we added a number of individuals. If you look at the total number of Louisianans who are currently eligible for vaccine, it's almost a third of the state. And so we don't know when we get to the next order of priority because it depends on the uptake. But what we do is we continually converse with those enrolled providers, hundreds of them around the state, and try to detect as soon as there's some slack in the appointment system. And as soon as there is some slack, that's an early indication that we can add some more individuals to the priority group that's then eligible to receive the vaccine. We're just not there yet. But I will tell you, I was very happy that this week we could get to pregnant women, that we can get to those 55 and older who have one or more of those comorbid health conditions, and that we could get through all the K through 12 and early childhood workers. not just teachers, but all of the workers. Incredibly important for our state. And then the other reason I can't answer your question is I don't know. He told us what we can expect in the first week that Johnson & Johnson is available. Is it available next week or is it the week after? We don't know yet. So you have to make your decisions so that you're taking all of that into consideration. And until something happens, you can't take it into consideration. But obviously, we look forward to continuing, as we are able, over time, to making the vaccine available to more individuals. And you know, I hope to do that sooner than later, but I can't give you a timeline. But thank you all very much, and thank you for continuing to cover these press conferences. We are in a better place, and I want to thank the people of Louisiana for that. It wouldn't happen but for the fact that many people in Louisiana take this virus seriously. They take this disease seriously. And quite frankly, and I think this gets back to a question that was earlier, I think there are the earliest signs now that the vaccinations are making a difference in our numbers, especially around hospitalizations and I suspect coming soon, deaths. Because while we haven't vaccinated, we started vaccination in 12% of our state, 70% of those shots have gone into the arms of people who are 60 and older. And so we always told you we wanted to vaccine people to make sure that we were preserving capacity in our hospital and saving lives. 70% of these shots are going into the arms of people 60 and older. Those were the people who were having the most serious cases of COVID-19, most likely to end up in the hospital and most likely to die. And so hopefully this will continue, but we are seeing the earliest signs that that is having its intended impact on what we're seeing in Louisiana. That is very, very gratifying. But we still have to wear our mask. We still have to get the vaccine when it's available to us. And let's all do our part. And if we will do that, I am absolutely convinced that sometime midsummer or so, we're going to be in a much, much different and better place with respect to the pandemic. So thank you all, and we will see you on Tuesday.